Welcome to Budget Types. Budgeting is about planning and control. Determining what to spend the money for requires planning. The budget process structures that decision process. Control, however, focuses on making sure that money is spent properly for the purposes intended. There are ways to structure the budget so that users pay attention to these concerns. Every financial transaction has to be entered into the accounting system, from paying a vendor or employee to collecting a fee from a customer. The budget builds from the collection and sorting of these hundreds of individual transactions. It doesn't matter how complex the budget is. The building blocks for any budget are the collection and sorting of all of these transactions. Laboratory managers should start the budgeting process by estimating what will be needed in the upcoming year for each line item, such as wages for each individual, medicine and drugs, office paper and pencils, and so on. Most of the time, the budget aggregates these transactions into broad groupings or categories, instead of listing each line item separately. Today, I'll present several budget formats that flow from the same example. I'll use small numbers, but think of them with many zeros behind each number to make them seem larger. So what questions arise if you were to view this budget presentation? I suspect you might want to know what line items comprise each category. For example, a personal service category, also known as personal emoluments, might include wages and salaries paid, health insurance paid for the workers, overtime payments, clothing allowances, employee taxes, or travel reimbursements, and other expenses associated with the compensation of workers. Similarly, a broad category of supplies would include office supplies, such as papers or pencils and binders, or program supplies, such as medical supplies, laboratory kits, and medicine and drugs. All of these supplies are expected to be used up during the year. A category known as services would include bills that are paid to others. One group would be for operational activities such as rent, auto repair, water and electricity services, telephone charges, external accounting and auditing fees, and printing and duplication charges. Another group of services might be program services, such as fees paid to external labs and charges for consulting experts. A category known as education might include professional continuing education expenses, support staff training, and memberships. A capital outlay category would include small, relatively inexpensive furniture, equipment, and tools for the office or lab, but they still need to be tagged and tracked because they may last longer than a year. Very expensive and long life capital assets, such as facilities and major pieces of equipment, may require a separate budget process in which the lab saves money over time to make a purchase, or in which a plan is made to delay the purchase until they can seek external funding from a donor or the government, or until the money can be borrowed. A line item budget, even if it's done by category, is the most common budget format. It's easy to prepare and understand. It's oriented to the inputs of a program, such as wages paid and supplies and services used. It's focused on the control of spending, but it lacks transparency about what the program actually does, or why the money is spent for this particular program. Budgets can be established with differing levels of control, such as the department level, program level, category level, or line item level. This may be done through law or through organizational policy. What it ultimately means is that overspending cannot occur beyond that level of control. For example, if control is established at the line item level and a lab is given a certain amount for office supplies, they can't spend any more than that amount. The budget will not allow them to overspend that line, drawing funds from other budgeted line items. Budgets can be more lenient when the level of control is established at the department level. In this case, they can spend all they want on office supplies until they reach the total amount budgeted for the department as a whole. Since most organizations provide a number of activities or services, it often helps to track expenses by program. This format is called a program budget. Here, we continue the same data example. The same 100 monetary units we used in the line item budget format are now reoriented into a series of programs that comprise the laboratory department's mission. What questions arise if you were to review a budget formatted like this? I suspect you respond by wondering what is leadership, or prevention, or testing, or inpatient service. Leadership might represent management expenses that cross all of the programs, such as the manager and the office staff. The hypothetical prevention program might cover the program's services such as advertising and community outreach. It may be intended to help the broader population identify their risky behavior, what can be done to avoid that risk, and how and where to get help if needed. Testing services provide a direct service to test for a particular medical problem, such as HIV. Finally, this hypothetical budget also includes inpatient services for the expenses associated with patients staying in beds for one night or more. In contrast to line item budgets, program budgets reorient the focus onto organizational goals and alternative strategies to reach those goals. Using our prior example, the laboratory department might want to consider more prevention programs and less inpatient services, because this shift might better advance the organization's goals. Instead of the budget focusing on line item objects of expenditure, such as supplies or fuel, the budget is allocating resources by program. A complicating element of program budgeting is that individual programs and their success may involve several programs and departments within an organization. Consider the case in which management directs which villages might be targeted for prevention services and testing during a particular month, in which technicians would go draw blood to test for a particular medical ailment and discuss prevention strategies with villagers. Medication may be provided to some villagers, and anyone who has a negative reaction may have to stay overnight at the clinic. In that example, a client could drive up costs in all 4 programs that comprise the laboratory department. Program budgets focus on strategic planning and program explanation. The key elements are to identify objectives, specify service level effectiveness measures, develop multiple year plans to achieve the desired results, and to evaluate any alternative strategies for meeting those objectives. For example, the objective may be to protect the public health, with services targeted at reducing incidents of risky behavior. Recognizing that prevention efforts take several years to show results, so a multi-year plan has to be in place. And alternative strategies for achieving effective results have to be developed and evaluated to see what works over time.